At work, I carry out hearing tests and prescribe hearing aids. So it's learning from the bottom and making your way up. So at the start, I spent a lot of time shadowing audiologists and learning the grounds of it and what actually audiology is. And then as I've progressed in my apprenticeship, I've got more and more involved in taking part. So at the moment, I'm carrying out hearing tests and prescribing hearing aids and fine-tuning them and things like that as well. I do feel like the support system at work is very good as well. So I do get set time each week, so it's normally a few hours, but from studying at work as well, you've got that support of the people who've done the same degree. You do always have a support system that's always balanced, and you've got people at uni that you can contact if you ever feel like you've got too many things going on at the same time. And there's always support wherever you need. But I think it's once you get into the rhythm of it, it was quite easy to balance them out once you've worked it out. I feel like it's made us become more confident and competent in the job itself. I feel like if it was a different route, not apprenticeship, I probably would have struggled a bit more. It's really let us come out my shell and things like that as well. Like, people don't understand that they're missing out on so much sound, and you've had people that leave the room and they go, "Oh, I was able to hear the birds for the first time in like 20 years, which is always a nice thing to say, and that always makes a nice change, the impact that you see on that hearing aids have on people once you've gave it to them.
The degree apprenticeship looks at routine audiology work, so it sets the learners up to progress into Band 5 roles within the NHS upon completion of the programme. So the teaching approaches that we find work really well is to develop the theory understanding first and then connect that directly with the clinical practice. So we have like a spiral curriculum which is set specifically to address each of the different competencies across the different levels of the programme. We start with more basic tasks in the first instance, and then we work our way up to more complex tasks in third year, and we deliver the underpinning knowledge which goes alongside that, along with clinical competency development and practice opportunities at the university to support the learning that they have while they're in their posts. We've got some great facilities at the University of Sunderland for audiology. We have a full range of simulation equipment, an Otis audiometry simulator, so the learners can practice doing hearing tests without having a patient in front of them, and we can use that to allow them to practice lots of different levels and types of hearing loss. We also have equipment to program hearing aids. We have a full setup of hearing aid programming, relay measurement equipment, video otoscopy. We also use the PCPI program, so we have patients who come in and we're able to practice taking patient histories, and that helps all with that development of those clinical skills.
Amazing, life-changing. It's gave us a route that I'm proud of working towards as well. Obviously a profession that I'm looking forward to getting in once I've graduated as well.
We ensure that the curriculum stays in line with academia and practice. I am a clinician myself and I work within the NHS as well as fulfilling a full-time role at the university, and I think that's really important in terms of the actual curriculum, because the work that I'm doing within the NHS is to current clinical practice and standards. The best thing about audiology for me is the opportunity to be able to be involved in assessment and clinical management of the patient, which I think is different from a lot of the other healthcare science specialities. So you're able to see a full patient pathway, which I think is really important and really rewarding in practice.